Dr. Cade, thanks so much for joining us here on Health Connection. Our topic is the flu shot. It's that time of year, and the question is, why should I get one? So it being that time of year, why is the flu vaccine so important, and when's the best time to get it?
So the flu vaccine is very important because it helps prevent disease and can also help the disease be milder if you do contract it. The best time to get the flu vaccine is early October or late September, as soon as it's available. It takes 2 weeks to have full effect, so the earlier you can get it, the better.
Okay. Why does it change every year? Why is it different with each passing year?
So the flu virus is a very effective virus in changing its own genetic material. It's constantly changing. It can live in humans, in birds, or in swine, and it can change in any of those organisms. So it's constantly evolving and changing itself, which is why we have to update the flu vaccine virus.
Okay. It's more important for some groups than others to get the flu vaccine. Who are those groups, and why is it important for them?
Some people are at higher risk for developing complications from the flu. Those are children under the age of 2, people over 65, pregnant women, people with chronic medical conditions, and also people who have a weakened immune system.
Okay. You hear people who are objecting to getting the flu vaccine. They say, well, I got the flu once from the flu vaccine. Is that even possible?
The flu vaccine contains either a completely inactivated form of the virus or a form of the virus that's so weak it cannot cause an active infection. So bottom line is no, the flu vaccine cannot cause the flu.
So anybody who says they got the flu from the vaccine already had the flu when they got
That's very possible because incubation from the flu can take several days. So there's a very good chance they were exposed to it before they got the flu vaccine. And the vaccine takes 2 weeks to go into effect, so they could have gotten exposed before the vaccine was effective.
So it's what we call correlation, not causation.
Correct.
Okay. Many people, particularly kids, but a lot of people just don't like getting shots. So let's talk about the nasal vaccine.
I'm a big fan of the nasal vaccine. It's approved in people ages 2 to 49. It can only be used in healthy people, so those that have chronic medical conditions, especially asthma, cannot have it. Pregnant women cannot get it. And it's most effective in young children, so the CDC actually recommends children ages 2 to 8 receive the nasal flu vaccine.
Why the age sensitivity to it? Why does the cutoff at age 50?
Usually the immune response is better the younger you are, and because the virus is a weakened form of it, the very young have a better immune response to it, so it's most effective. It's just less effective in people as they age. That's why it's at 50.
How do you know if it's the flu or if it's a common cold?
That's a very good question. Sometimes doctors don't even know. They can be so common. So the flu usually causes a fever. The symptoms are usually more severe, but flu and cold can cause fever, runny nose, cough, sore throat, and body aches. Usually the flu comes on really quickly and the symptoms are more severe. The flu can also lead to complications such as sinus infections, ear infections, bronchitis, and pneumonia, and the cold does not do that. If you're concerned, you can see your doctor because your doctor can perform a test to tell the difference between the cold and the flu.
All right, you just said test. Let's say somebody tests positive for the flu. Mm-hmm. How do you prevent or reduce the likelihood of other members of the household getting the flu?
So the flu virus is very contagious. It's spread through droplets, which are spread when someone speaks, when they sneeze, or when they cough, and they can infect someone as far away as 6 feet. So it's best to limit exposure to the sick person, to make sure the sick person covers their cough and their sneezes, to make sure they wash their hands a lot, and to not share eating utensils with that person.
Okay. Over-the-counter medications, are there any that work, and which ones for treating symptoms of the flu?
So flu symptoms can vary from person to person, so it's best just to target your main symptoms. So acetaminophen or NSAIDs can be effective for pain, for body aches, for fever. Antihistamines can help with runny nose. Decongestants can help with nasal stuffiness, so that could be pseudoephedrine. And then cough suppressants can help with the cough, such as guanfacine or dextromethorphan. Okay.
And if I want those 2 compounds you just mentioned, how do you buy them over the counter? What am I looking for? What's on the package?
It's best to consult with the pharmacist and tell them your symptoms. It's best to stick with formulations that are single ingredient and not a lot of the multi-ingredient formulations.
Okay.
And as far as looking on the package, some brand names would be Robitussin or Mucinex,
Okay.
Sudafed or Benadryl.
Okay. You got the flu. Is there anything you can do to shorten the duration, or you just have to fight the symptoms and wait it out?
So antiviral medications can be effective in shortening the duration of the flu. The effectiveness is usually very modest, and for most people, an antiviral is not indicated. We usually treat people that are higher risk from developing complications from the flu with antivirals, so most people do not require treatment.
What about the drug you see advertised on TV called Tamiflu?
Tamiflu is by far the most common medication we use to treat the flu. It's indicated for people that are under the age of 2, over the age of 65, who have chronic medical conditions or who are hospitalized. It can shorten the duration of the flu by up to a day, so it's a pretty modest effect.
Okay. If you get the flu, how important is it to stay home from work or school, and when is it okay to go back?
It's very important. The flu is very contagious. So as long as you are sick, you need to stay home. You can actually shed the virus 1 day before symptoms start and up to 5 days after symptoms start. So you can be contagious for a long period of time. We recommend that you stay home until you are 24 hours fever-free without the use of any medications.
Okay. We've heard news reports fairly recently that they're working on a single shot that will prevent all strains of the flu going forward. Is that going to happen anytime soon?
So that's very exciting. A group of researchers from the Institute of Health published a paper this summer where they exposed mice to pieces of the flu virus, and those mice were actually protected from flu strains that were not in those pieces. So it's very exciting. They're hoping to have clinical trials next year, but we're still a few years out from that.
All right. Doctor, we learned a lot. Thank you very much.
Thank you.